not sure what his injuries are, so we're going to scan him and find out what's broken. All right, everyone ready? The real question is, do we have internal bleeding? Does he have a head injury? Does he have a chest injury? Any number of other injuries that can be the reason why he's unsafe.
Breathe, buddy. Just breathe. Just breathe.
Let's go. He's got at least one fracture there. That's another. 1 and 2 are fractured. He broke multiple ribs, and now both of his lungs are punctured.
Welcome everyone. Thank you for joining me in this brief overview of the Respiratory Critical Care course. You may be asking yourself, what is this all about? The Respiratory Critical Care course is a 3-day module designed for the registered nurse who is currently working or will be working in an acute care area, including but not limited to the emergency department, telemetry, ICU, CCU, and respiratory units. The nurse will be introduced to topics related to respiratory critical care. As I mentioned before, this is a 3-day course that will introduce nurses to respiratory critical care. Upon completion of this course, you all will be able to successfully recognize potential patient complications from chest trauma, demonstrate daily care and maintenance of the patient's tracheostomy, differentiate between respiratory and metabolic acidosis and/or alkalosis, create a comprehensive individualized care plan for the adult patient with pulmonary diseases, identify appropriate airway management devices for the patient in respiratory distress, discuss the nursing considerations for the use of artificial airways and various modes of oxygen administration, describe the appropriate nursing actions warranted for ventilator high and low alarms, and finally, anticipate possible complications for the patient receiving conscious sedation related to specific drugs. Before you all begin to think, whoa, that's a lot, take a deep breath and just keep listening. All you need is an 84% or better on the exam to pass. Throughout the 3 days, you are encouraged to come prepared. Attendance is mandatory. Read the required text, participate in class, and ask questions. By following these simple recommendations, successful completion is nearly a guarantee. So what will we be talking about? Our topics include respiratory physiology, managing an airway, patients on mechanical ventilation, including CPAP and BiPAP. You all will participate in a ventilator workshop and case studies. We will be discussing care of the patient with a tracheostomy, acid-base balance, care of the patient under sedation, pulmonary diseases in the adult, chest trauma, and care of the patient with a chest tube. I look forward to meeting you all and working with you. If you should have any questions prior to the start of class, feel free to contact me. Thank you and see you soon.